Now we're going to monitor our IV. So Mrs. Winter Snow has had the IV in and it is infusing. We are going to come into her room and say, "Good morning, Mrs. Snow. I'm going to be just monitoring your IV." So I'm going to come in, I'm going to wash my hands. We're going to come to her IV and make sure that everything on the IV is running correctly. What we're going to do is we're going to start at the top and work our way down. So I know that the IV solution that is running is D5.45 normal saline, and that is what is ordered. If that was not the correct solution, then what I would need to do is slow this IV down by roller clamping it down and slowing the solution down, going out and getting the correct solution, coming back and hanging that ordered solution. In that case, I would have to fill out an incident report depending on what your agency would require of you. But in our case, the solution is running correctly, and so I don't have to worry about changing that solution out. The next, we're going to follow it down and look into that drip chamber. The drip chamber should be half full, and that's where the solution is right now. And then we would count the drips and make sure that it is running at the prescribed rate. Now, if I came in and it was running this fast, I would know that that IV solution is running too quickly. So then I would go to my roller clamp and I again would roller it down to close the solution down so that now it's dripping at the prescribed rate. And I could determine that by timing the number of drips that falls within a minute period of time. Now, if it was running too slow, I would just do the opposite to it. I would increase it to the prescribed amount. And depending on if it's running too fast or too slow for too long, that would also be an incident report because it wasn't running at the prescribed rate to do that. So if the IV is running at 150 milliliters an hour or faster, then what I would need to do is make sure I come in and check this IV every 15 minutes to 30 minutes. Normally we would check an IV every hour that the patient is running. So in our drip chamber, we've determined that the solution is the correct solution. It's dripping at the correct rate, and there is about a half of the chamber is full. And also we'd want to make sure that the IV bag itself is at least 3 feet above the patient. And so that looks like it's a pretty good distance as well. So then we're going to proceed down from the drip chamber. We're going to go down and check the tubing itself. We're making sure that there is no kinks or coils into the tubing. The tubing should be gently coiled on the bed, but no kinks into it. So when I come in, I want to make sure that the tubing is not hanging down like this onto the floor with big dependent loops. So if that was the case, then I would just pick it up and coil it back up onto her bed so that the tubing isn't in her way and it's not going to be pinched or kinked at all. So then we work our way down to the IV site itself. And this is when we're monitoring. We're going to make sure that the IV site is, everything there looks good. So in that case, it should be her normal skin color. It should not be tender to her at all. So I would palpate around the site and say, "Mrs. Snow, is that sore or tender at all?" And she should tell me no, that there's no tenderness there. If there would be tenderness, it could be an inflammation that is starting to it. If that was the case, you would see redness right here at the IV site, and it would be, like I said, tender around there, and it might even feel warm to the touch. If that was the case, then I would remove this IV and restart it in a different site. Another problem that can come with the IV site itself is that it can be infiltrated. If the IV is infiltrated, that means it's no longer running into the vein. The fluid is running into the subcutaneous tissue. So when I would look at this, it would be cool to the touch because the IV fluid would be cool. She would tell me that it's sore and it's tender, and it would be swollen. It would be quite edematous around that area, and it probably is not running at the right rate either. It's running very slowly. And in that case, again, I would remove the IV from this site and restart it somewhere else. In either of those cases, I could put a warm washcloth onto her arm and elevate it to take some of that swelling or inflammation down. The other problem is that the IV rate might not be running very well. It's just running kind of sluggish. So in that case, what I'm going to do is I'm going to check to see if it is patent or not, or if it's occluded. So what we're going to do is we're going to take the IV itself and the nearest port. So this is the closest port to her IV site. I'm going to take an alcohol and I'm going to clean that site. So I'm going to take and clean it vigorously for about 15 seconds. So we're cleaning it, making sure that we cleaned it for our 15 seconds. And then we're going to take and hook up the syringe. And now what I'm going to do is I'm going to pinch the tubing on the IV side. So this is the tubing that's going back up to the IV bag. And in this case, I would check to make sure if we have a blood return. So right here is where I would be looking for a blood return. I'm going to pull the plunger back, and if this was connected to a real patient, you would see blood that's coming up into this tubing. That would indicate that the IV is actually in the vein and it is running. If that's the case, then I could gently push down on the plunger and I could see if I could flush this IV by pushing some fluid in and through to that. The patient shouldn't feel any discomfort at this point, and it should flush very easily. If that was the case, if it could not, I could not push the fluid through, or if it was uncomfortable for the patient, then I would again discontinue this IV, stop this, take this IV out, and start it in a new at a new site. The fourth problem that may develop with an IV is that it could start to ooze, have some small amount of bleeding right here at the site where the catheter goes into the patient's arm. If that is the case, I can take this dressing off and clean it up and see if that fixes the problem by maybe stabilizing the IV a little bit better. But many times that's an indicator that this IV is no longer going to function very much longer, and it would have to be discontinued, and the IV would have to be restarted in a new area. So after we've done all of our monitoring of it, we would talk to the patient and make sure she understands the things that she needs to do. So Mrs. Snow, I want to make sure that you understand if you get up and need to use the restroom or go for a walk, you need to bring the IV with you or call for help, and we will help you do that. Try not to lay on the tubing or get it coiled at all underneath you. That can cause some difficulty with the IV itself. It is the nurse's responsibility to make sure that the IV solution is adequate in the bag, that the IV is dripping, and that there is no blood that's returning up into the IV solution. So those are the things that the nurses also would take care of. If it was uncomfortable for Mrs. Snow at any point in time, I would always encourage her to call the nurse and have them come in and make sure that everything's running all right. So when we're monitoring, we always work from our top to the bottom of the patient, and we'd come back in an hour and make sure that all of the things that we talked about are in place. And then the final thing that I would do is do my documentation that yes, indeed, I was here and I did check this IV and everything is running fine.